Vilobelimab is a medication that the FDA has allowed for emergency use to treat COVID-19. It is specifically used for people who are in the hospital and are unable to breathe on their own, such as those on a mechanical ventilator. Vilobelimab belongs to a class of drugs called monoclonal antibodies, which work by blocking the effects of a protein in the body's immune system that causes inflammation. This blocking effect may help prevent the worsening of COVID-19. It is important to talk to your doctor about the risks and benefits of treatment with Vilobelimab. While there is limited information about how safe and effective Vilobelimab is for treating COVID-19, study results have indicated that it may help decrease the risk of death in certain people with COVID-19 who are hospitalized. If you are considering taking Vilobelimab, it's crucial to consult with your doctor to understand the potential benefits, daily dosage, and the optimal timing for taking this medication. Remember that the information about Vilobelimab is constantly evolving, so it's important for your healthcare professional to provide you with the most up-to-date information and for you to exercise caution and independent judgment when considering its use. Your doctor will give you this medication through a slow injection into a vein, which will usually take about 30 to 60 minutes. You may receive up to 6 doses of this medication on certain days while you are in the hospital, depending on your medical condition and how you respond to the treatment. If your condition does not improve or if it worsens, be sure to inform your doctor. When using Vilobelimab to treat COVID-19, there have been cases of other serious infections reported. If you experience any new or worsening signs of infection such as a sore throat that doesn't go away, fever, chills, cough, painful urination, or sores around the mouth/genitals, it's important to inform your doctor immediately. A very serious allergic reaction to this drug is rare, but it's crucial to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. The full extent of potential side effects of Vilobelimab is still unknown at this time. If you are experiencing any side effects, it's important to contact your doctor for medical advice. Before starting Vilobelimab, it's important to discuss any allergies with your doctor. This medication may contain inactive ingredients that could cause allergic reactions. There is limited information about how Vilobelimab may interact with other medical conditions, so be sure to discuss your medical history with your doctor before starting this medication. To prevent the spread of the virus, it's important to continue taking precautions such as self-isolation, wearing a mask, practicing social distancing, and washing hands. If you are pregnant or think you might be pregnant, talk to your doctor about the potential benefits and risks of using Vilobelimab during pregnancy. It's unknown whether Vilobelimab passes into breast milk, so be sure to discuss the risks and benefits of breastfeeding while using this medication with your doctor. When taking Vilobelimab, it's important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. As of now, there is limited information about whether Vilobelimab has any interactions with other drugs. To stay safe, it's recommended to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Vilobelimab in your treatment plan. At this time, information about overdosing on Vilobelimab 10 mg per milliliter intravenous solution (EUA) is not available. It is important to follow the prescribed dosage and consult your healthcare provider if you have any concerns about the medication. The intravenous solution Vilobelimab 10 mg per milliliter, also known as an EUA, is used to treat various autoimmune and inflammatory diseases. It is administered through a vein and is typically used in a hospital or clinical setting. The dosage and frequency of administration will be determined by your healthcare provider based on your specific condition. It is important to follow their instructions carefully and to not miss any doses. This medication may provide benefits such as reducing inflammation and improving symptoms associated with autoimmune diseases. It is important to take this medication at the recommended times to ensure its effectiveness in managing your condition. Always consult with your healthcare provider for the best timing for your personal situation. The intravenous solution Vilobelimab 10 mg per milliliter, also known as an EUA, is used to treat various autoimmune and inflammatory diseases. It is administered through a vein and is typically used in a hospital or clinical setting. The dosage and frequency of administration will be determined by your healthcare provider based on your specific condition. It is important to follow their instructions carefully and to not miss any doses. This medication may provide benefits such as reducing inflammation and improving symptoms associated with autoimmune diseases. It is important to take this medication at the recommended times to ensure its effectiveness in managing your condition. Always consult with your healthcare provider for the best timing for your personal situation. This medication, Vilobelimab 10 mg per milliliter intravenous solution, EUA, is administered in a hospital setting and is not intended for home storage. It is used for the treatment of certain medical conditions and is given intravenously by healthcare professionals. The dosage and timing of administration will be determined by a healthcare provider based on the individual's specific medical needs. It is important to follow the healthcare provider's instructions regarding the use of this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.